Is bleeding after hair transplantation is normal? After the surgery, we expect some small bleedings in the first night or in the second day also. But it's very minimal. We do not expect a continuous bleeding. Maybe it's just pop-up of the grafts in some parts, and it's very minimal bleeding. And it shouldn't be, there is no need to do something for that. Just pressing over it will be enough.
For how long do I have to wait before I can have my second hair transplant surgery? The answer for this question is different. We need to wait for at least 6 to 12 months before the second surgery. If we didn't perform any incisions or implantations at the area we want to perform the second surgery, we can do next surgery 6 months after. But if there were any implantations or incisions, it's better to wait for at least 12 months.
Is hair transplant noticeable after the transplantation? Hair transplant is not noticeable in the end, but in the progress, at least after 3rd week until 4th month or 5th month, until the hairs grow, yes, some redness may occur, or some, due to density, in lack of density, it may be noticeable. But when it's totally grown and we see the real result, if it is done very properly, with the right angle, with the right direction and right implantation, it is not noticeable. So whatever we want to do for the patients is giving a natural and aesthetical look after the surgery and the result.
Can you wear a hat after hair transplant? You can wear a hat you want after 10 days of your hair transplant. For 10 days you are going to wear a loose hat, or sometimes a bandana or a loose scarf will really work.
Can you go outside or walk under the sun after the hair transplant surgery? There are no restrictions regarding the aspects. The only thing we tell our patients is to avoid too much sunlight exposure or ultraviolet light exposure for the first 6 months after the hair transplant surgery. We ask it for 2 reasons. First of all, it can cause extensive scar formation, that's number 1. And number 2, it can cause an altered pigmentation across your scalp. So for the first 6 months after the hair transplant surgery, if you're going to be under direct sunlight for a longer period of time, please use a hat, cap, or a sunscreen with an SPF 40 to 50.
Do you need Finasterid usage after the hair transplantation? Yeah, this is something we recommend patients to use it, because normally the Finasterid usage is mostly for the not for the implanted hairs, for the existing hairs, because when we do the implantation, there are some also existing hairs, and we need to improve the thickness in order to give a combination treatment to the patient, because the transplanted hairs will grow, but if the patient loses his actual hair, existing hair, it means that he may need another surgery. But our thing is to think the patient in a 360 degree, and we want them to have a good result in the future. So for keeping the hairs not to lose it and also improve the thickness, we want to use Finasterid, maybe in some patients also Minoxidil too.
When can I shower normally after hair transplant? You can use your shower with normal pressure after your hair transplant after 10 days. In 10 days, your grafts will be attached to your skin, so there will be no harm for your grafts with the normal pressurized water.
When you will start seeing the regrowth or growth of the hair after the hair transplant surgery? After the hair transplant surgery, your hair will immediately start to grow. But around week 4 to 8, you will start to notice your new hair, transplanted hair, will suddenly start to shed off. This is the normal physiology and biology of your hair. This phenomenon is called the shock hair loss. After that, when the shock hair loss is over, your new hair will start to regrow around week 8 to 16 after the hair transplant surgery. We see initial results around 4 to 6 months after the hair transplant surgery. Initial results are only 30, maybe up to the 50% of the final results. Good results will take up to 1 year. It's around 80 to 85% of the results. And final results may take up to 18 months after the hair transplant surgery.
When can I go gym after hair transplant? You can start light exercises after 15 days of your hair transplant. After 1 month, you can fully resume your activities and you can hit the gym really hard.
Should you continue oral medications for a lifelong time after the hair transplant surgery? The answer is very individual because we never know when the shedding or the hair loss will stop. In some patients, the hair loss may stop immediately after the hair transplant surgery because the active stage of the shedding is gone. Or in some patients, it may last up to the age of 50 or even 55.
Can I comb my hair after transplant? You can comb your hair after the transplant because it's your existing hair, it's your hair. You can use even long hair, you can comb it, you can do any style. It doesn't interfere or it doesn't avoided by the hair transplantation procedure. You can use it as normal.
Which shampoo is best after hair transplant? Any natural shampoo will do good after your hair transplant. You should avoid harmful chemicals, and you can Google the ingredients of the shampoo and you may choose the best one. But if you ask my personal opinion, you may buy natural olive oil shampoos that will work.
Is it must for the patient to have a PRP treatment after the hair transplant surgery? PRP is not a must treatment after the hair transplant surgery, but we advise it because it facilitates the regrowth of the hair, helps to fight with miniaturization and recovery of the skin after the hair transplant surgery.
How long after the grafts become secure after the surgery? The grafts become secure at least 5 to 10 days after the surgery, but the first 24 hours, of course, the incisions that we did during the operation will be more, the wound edge will be closed, so it will become stabilized but still fragile. After the 5th, sometimes 6, 7 or until 10 days, the grafts may be not so secure, so patients should avoid some kind of wearing hats or sleeping as normally, or the things that we advise after the postoperative care is the important thing. So patients should avoid everything at least at 10 days.
Does hair in the donor area grow back? No, it does not. We just cover that bald spots with the existing hair after your hair transplant. So every time you have your hair transplant, your donor area loses its density a little, like 20 to 30%.
What should be the temperature of the water for the wash after the hair transplant surgery? We advise our patients to wash their head for the first 1 month after the hair transplant surgery every day. For the first 2 weeks, it should be done the way it's explained in the clinic or shown on our video. The temperature of the water should be the warm one. It should not be very cold, it should not be hot. The warm, comfortable temperature of the water is enough.
When I go back to work after hair transplantation, patients after the hair transplantation go to the work even 2 days later, 1 day or 2 days later. Why? Because it's not a physical thing. But of course, if patient wants to rest, we recommend them to at least 1 or 2 days to rest, and then they go to their work. But the main thing maybe the patient's concerned about that is patients may not be seen by other people or eyes on their hair transplantation. So sometimes they do not want to go to work very soon, but they can just go back to their work 2 days later.
When will I see the final results of the hair transplant? You will see the final result of the hair transplant after 2 years. In 6 months, you will start to see some results. For some people, it's much more better than they expected. And in 6 to 8 months, it will increase density, like it will be the final results density like 8% of the final results density. In 1 year, it will be like 90% of the final results density. And in 2 years, you will see the final result.
How long you should take a rest after the hair transplant surgery? It depends on the type of job you do. If you work on any physical job, we advise our patients to stay away from the physical activity and dusty environments for the first 10 to 14 days after the hair transplant surgery till the scabs are off. If you work in an office condition or in an outdoor or from home, you can be booked to work 2 to 3 days after the hair transplant surgery.
What kind of medications patients need to use in long term progress. Patients may need to use Finasterid, Minoxidil, which are FDA-approved treatments after the hair transplantation according to their existing hair's condition. If they have a very thinning miniaturized hairs in their recipient side, in order to prevent them for future hair loss or in order to give the thickness to them, patients may need to use Minoxidil and Finasterid medication after the transplantation at least a year, and after a year we need to re-evaluate it again.
Will I continue to lose my existing hair after hair transplant? Hair transplant do not protect your existing hair or do not cause you to lose them in the future. It's all about your genetics. If your genetic is coded to lose your hair, then you will.
What happens if you don't see any regrowth of the hair 3 to 4 months after the hair transplant surgery? We expect the regrowth of the hair at around week 8 to 16 after the hair transplant surgery. In some patients, the regrowth may take a little bit longer. For this reason, we ask for our patients to wait for at least 6 months to see at least 30 to 40% of the regrowth of the hair.
When can I have sexual intercourse after the hair transplantation? Hair transplantation is a normal procedure, and after the hair transplantations, patients may have sexual intercourse. There is no contraindication for that. Even after just after the surgery, it's possible to do because it's not a contraindication for the transplantation. Only the patients have to take care is not to sweat too much during all physical activities like a sexual intercourse.
Can I shower on my hair transplant day? You can. You should avoid water on the newly transplanted zone, and you can wash just below your neck.
Should you use Finasterid after the hair transplant surgery? Finasterid is one of the 2 FDA-approved medical treatments for the hair loss. Finasterid is the most potent or efficient medication today we have to treat the androgenetic alopecia. At least 85% of the patients who use the Finasterid, they stop the hair loss and the hair start to improve, gaining back their volume and density.
What's the success rates of the hair transplantation? After the operation, we expect some success rates in different areas. Especially the frontal area is more vascularized, so the success rates are more than 90 to 95%. But when we come for the crown area, due to circulation, due to anatomical and physiological conditions, the success rates are 70 to 80%, and it depends on the grafts needed by hair transplantation in the desired area. If patient needs too high graft numbers in the vertex, even implanting more grafts to that area will be resulted as lower success rates. So according to the hair transplantation principles, every area, each different area needs different density implantation during the surgery.
Can I use clippers after hair transplant? You may start to use clippers for the sides and the donor zone 1 month after the hair transplant. But for the new hair, you should wait for 6 months to use clippers.
Do you need to use the Minoxidil after the hair transplant surgery? Minoxidil is one of 2 FDA-approved medical treatments for the hair loss problems. The Minoxidil use is not the must, but we advise it for the patients with androgenetic alopecia to minimize the miniaturization of the hair, help with the regrowth of the hair after the hair transplant surgery.
Should I use PRP before or after the surgery? Actually, PRP is not most of the doctors approved solution for the hair loss treatment, but in my daily practice and in our clinic, the other doctors prefer PRP when there is onset of the hair loss. So repeated PRP sessions is very beneficial and affected by the hair loss problems. And after the surgery, it gives a good recovery period, it heals better, and the growth will be quicker if it is done repeatedly, at least a month for 5 to 6 months.
When can I fly after the hair transplant procedure? The next day of your operation, after the doctors consult you and they say it's okay for you to fly, you can fly back to your country.
Can you drive a car after the hair transplant surgery? We advise our patients to ask someone to pick them up and drop back home after the hair transplant surgery. We do it for a couple of reasons. First of all, a hair transplant surgery is a 6 to 8 hours procedure. So basically you can be really tired after the procedure. Number two, during the surgery, we administer some medication to the patients, and some of them can make you feel a little bit sleepy. So for your safety, please don't drive the car immediately after the hair transplant surgery.
Does hair transplantation have side effects? After the operation, we sometimes see some side effects, but they are mostly expected things. It's not resulted as a complication. So whatever we see usually is a forehead swelling in the front, sometimes redness after the operation, at least last 2 to 3 weeks. And during the growth phase, we see some pimples in the recipient side. But if we are talking about the complications, which is very rare and could be still seen in an unskilled hand, is the tissue necrosis in the recipient side, and also a donor shock loss area, which could be resulted as not aesthetical looking after the operation.
Can you color or dye your hair after the hair transplant surgery? Yes, you can. But we advise our patients to start dyeing their or coloring their hair 6 to 8 weeks after the hair transplant surgery, when the regrowth of the hair will start.
How can I sleep after hair transplantation? Patients after the hair transplantation should sleep at their donor area at least 7 to 10 days. If they avoid and if the transplanted hairs not touch the pillow or other things during the sleeping, it's okay. But we usually recommend patients to use a neck pillow and to avoid to turning to right or left, and sleeping on donor area is the safest part for the patient's condition.
Are there any dietary restrictions after the hair transplant surgery? There are minimum or close to no dietary restrictions. The only thing we require our patients is to avoid alcohol for the first 10 days after the surgery. Also, we ask them to do some restrictions on spicy or salty food for the first 3 to 5 days. Of course, you can have some spicy or salty food, but it should be within the normal limits and with no exaggeration.
What diet should patients have after the hair transplantation? After the hair transplantation, we do not recommend too many restrictions for the diet, but at least 2 to 3 days in order to prevent some swelling. We do not want patients to eat more salt during their diet. But other than that, there is no restriction with any food preference. Can I cut my transplanted hair? After the surgery, we want patients at least for a month not to shave or cut or trim their hairs. Usually after a month, you can use scissors for the recipient side or trimmers or clippers for the donor side to shave your hairs. But other than that, at least for 2 to 3 months, we do not want you to use the trimmers or clippers in the recipient side, because it may pull or damage the skin or hairs. That's why you should avoid that.
How often should you wash your hair after the hair transplant surgery? For the first 30 days after the hair transplant surgery, you should wash your hair every day. But for the first 2 weeks after the hair transplant surgery, you should wash your hair the way we explain you in the clinic, or it's explained in the guideline.
Do you have to take medication after the hair transplantation? Patients may need some medications after the surgery. As a package, we provide patients to use after the surgery as antibiotics, painkillers, and other anti-swelling medications. But sometimes, according to the consultation and the hair transplantation procedure technique, they may need to use other one-year medications that your doctor may prescribe to you. But it depends on the patient's condition.